know, February is Heart Month, but taking care of your heart health really should be a priority year-round. This is whether you're 25 or 75 or anything in between. Now's the time to make sure that you're taking charge when it comes to your heart health. So today we are joined by Dr. Bridget Christopher, a cardiologist with Cone Health Heart and Vascular at Drawbridge Parkway, and we're going to talk about what you can do to protect your heart. So let's talk about this. Let's talk about what the most common misconceptions that people have about heart disease that we can set straight right from the get-go.
Love this. So there are really three things when people come in to talk to me and that they had never planned to come in to talk to a heart doctor before. The first is that they believe that they would feel it if they had a heart issue. So a lot of people said, well, I have not had that Hollywood chest pain. I've not had other issues. So I had no idea that there was any problem. Another thing that people say is, well, I don't have a family history of heart issues, so I thought that I would be fine. And the other piece of that is the flip side, that people have said, well, everyone in my family ends up with heart problems. No one's escaped it. I didn't think that there was anything necessarily I could do about it. So I didn't really see the point in going and talking to a doctor about it.
Okay, so we're going to dispel all three of those and kind of talk about them. So let's talk about this. Heart disease doesn't just affect older adults. Let's talk about how younger people are at risk as well.
Absolutely. So one of the important things that I tell people is that most heart problems take decades before they start to show up and having an issue. So for example, when we talk about cholesterol and how that can build up and cause plaque in your vessels, that's a process that can take 10, 20, 30 years or more. And people don't realize that it's something that they can start to identify very early in life and start to make changes to hopefully prevent future buildup. Another thing people don't realize that they have so much impact in terms of what the next 10, 20, 50 years of their life looks like is how they handle their lifestyle and make choices. And we'll talk a little bit more about that in detail, but absolutely, lifestyle choices that people make in their 20s and 30s impact 70s and 80s down the road. So it's really important to think about your future self. Another thing that people don't often think about is, well, I'm young, I don't have any heart issues, and even if I'm dealing with other things, other types of medical issues, it's probably not going to have anything to do with my heart down the road. And that's not always necessarily true. So it's important that even if you're young, to get any issues you might have sort of under control now so that they don't cause you problems down the road.
All right, let's talk about 3 steps all of us need to take to help reduce our risk of heart disease and take better care. I love 3, so that's like 3 easy things, 3 things that are manageable. It's not an overwhelming long list.
I love this. So one of the first things I tell people, and every time I talk to groups or patients or families, it's really important that people know their numbers. The American Heart Association has a great website with some very specifics about some of those numbers, but it's things like, what's your blood pressure? What's your cholesterol? What should your healthy weight be? Do you have or are you at risk for diabetes? These are all numbers that can be screened, that can change over time. And so knowing your numbers absolutely impacts how you manage your long-term risk. So number 1, know your numbers. Second is know your family history. Coming back to that beginning, family history isn't everything, but it's important. And so people who have an increased risk running through their family, it's important to know that early. So some families don't like to talk about things necessarily at the dinner table, but I tell people it's really important to have those conversations and know your family history so you can know your risk. And then the third thing, which we'll talk a little bit more, is making healthy lifestyle choices.
Okay, so we're going to use that as the jumping point. Let's talk about those lifestyle choices and those lifestyle changes that we can make that many people may not really think about that can really have a good impact on their heart health.
I love it. So one of the big things that gets a lot of attention is food. And I get a lot of questions about what should I be eating, what's healthy, what's not healthy. And there are lots of jokes on the internet and videos about how many different times we've changed our mind about what might be healthy and what's not. So I tell people to take a step back. What we know is things like the Mediterranean diet. And I'll talk a little bit about what that is. But we have now a lot of information that the Mediterranean diet is heart healthy, it's anti-inflammatory, it can be low salt, it can be low sugar, it can be sort of whatever you need it to be. And it's pretty straightforward. So Lots of fruits and vegetables. That's the bottom of their food pyramid, really. Fresh food. So your food shouldn't, be able to sit on a counter for 2 weeks, like what my kids like to eat, and not spoil. It should be food that you're going to eat when it's fresh, and it's going to go bad if you don't eat it. It's healthy fats. So not all fats are bad. Things like olive oil have a lot of healthy fat to them. Things like lean protein, almonds, tree nuts, fish, if you like fish, are really important. And then whole grains. Grains aren't the bottom of the food pyramid for them. It's not the crux of it. They're more of a side dish. And it's not highly processed. So really the Mediterranean diet works for everybody, and you can adjust that to whatever lifestyle you might need. So I think diet's probably our number one. After that, it's things like exercise. And people ask, what should I be doing? We have a lot of data that walking 150 minutes a week is what can keep you out of the hospital and help you live longer. Anything more intense than that, longer than that, is great and beneficial. But from a heart perspective, walking will do it. So we really encourage people to try to increase their activity in their walking. And then the next things are things like healthy sleep, avoiding tobacco, trying to minimize stress. Those are all part of the big picture of what can kind of impact the heart, but really focusing on the healthy food choices and the activity can make a huge difference.
Okay. When we come back, we're going to be talking about what do you do if you do have a family history of heart disease. That's coming up next.